Antibiotic resistance is a big problem in this country, and if you ask me, I think the reasons are multiple rather than just one sector being held accountable. If we look at the side of the healthcare sector, we need to have antimicrobial stewardship. What that means is you have guidelines that when a certain patient comes in with a certain disease, for example a pneumonia, it shouldn't be a free-for-all. Every doctor should not treat with whatever antibiotic they want. There should be guidelines that are prescribed to every practicing physician to say this is the bacteria that's most likely to cause pneumonia in our country, and these are the antibiotics that respond. There are patient factors and microbial factors, and they need to come together to dictate what antibiotics we use. Currently, whether you go to a hospital or you go to a small healthcare facility, you go to the government, everybody prescribes different antibiotics. So I think that is one of the major reasons that there's antimicrobial or antibiotic misuse in the country. You can even go to a pharmacy in this country and get antibiotics. I mean, the prescribing is not controlled, and the pharmacists will prescribe what they have or what they believe the patient needs, rather than it being dictated or informed by guidelines and research. So there is really no hold on what doctors prescribe. Of course, we have the antibiotic resistance coming in from the agriculture and the livestock, which passes down the food chain to the patient. In addition to that, I must say that there is no regulation that says that these antibiotics are what they say. There has to be a very strong national body that looks at all these antibiotics to say that the antibiotics coming into the country have the composition, have the molecules that they have. They may have a lower dose of ingredient in the capsule or in the tablet, which if the patient takes leads to antibiotic resistance. And I think we need to attack the issue of antibiotic resistance from multiple areas. Multiple regions need to address it so that we don't run into issues of pan or multi-drug resistant microbes for which we won't have antibiotics in the future.